Hey there, my name is Meagan Clanahan. I am the co-owner of Houston Moms, and every month we bring to you a monthly health series video from our friends and partners at UTMB Health. They are our preferred providers at the Southeast Texas area, Bay City, Pearland, Galveston, all of you people down there. This is who you need to go see. Uh, this month we are talking about Mommy Makeovers, and also all the things you need to know about Botox and fillers, non-surgical options as well. And I think sometimes it can be a little, sketchy to like talk about it on social media amongst your friends. And so our goal is to just provide you the information from our providers so that maybe you can make the best decision for you and your body. And UTMB Health recently launched in April 2021 their plastics and aesthetic center. And so they have a one-stop shop where they are ready to take care of you if that is the market that you're in. And so our goal is just to chat about all those things. And then, of course, as always, we'll drop the links below of how you can get in touch with one of these providers or any of the other ones in that clinic as well. So joining me today is Dr. Kroger and Dr. Phillips. Thank you all so much for joining us.
Thank you for having us.
Absolutely. Dr. Kroger, let's start with you. Can you tell us a little bit about yourself and your practice and where you are?
Sure. So I'm Kathleen Kroger. I'm one of the dermatologists here at UTMB. So I have both a clinic in League City, both in our medical clinic at Victory Town Lakes, and then also one at the Plastic Surgery and Aesthetics Center, and also one in Galveston as well.
Wonderful. And you're a mama too. You were telling me you're a
I
mama too.
am. I'm a first-time mom, so I have a little 18-month-old girl at home. Her name's Ava. So she keeps me very busy. So I totally understand the struggle as a mom, not only to take care of everyone else in the household, but really try to find time to really take care of yourself too. So I think this is a perfect topic to talk about today.
Absolutely. It's so very important, especially when you're in those trenches with those toddlers. 18 months is a great age, though, I have to tell you.
It is.
It's so fun. Dr. Phillips, thank you so much for joining us. Can you tell us a little bit about yourself as well?
So I'm the chief of plastic surgery here at Galveston. I have office hours at the League City campus and also at the Victory Lakes Town Center Aesthetics Center, along with Dr. Kroger and other dermatologists. Um, so we're right there off the freeway. We Well, about me, I've raised four children with my husband, who's an orthopedic surgeon, and our children are adults, and we have three grandchildren now as well. So I totally understand and get it. I remember juggling the plates. Some days they stay all in the air, some days they don't when you're a busy mom. And I get reminders when I help out as the grandmother babysitter. I recognize how busy it really was.
Indeed, a four and a husband that was a surgeon. My goodness. And you're here to tell the tale.
I
So
lived through it.
that's a really great. And so we're going to start kind of with the surgical side on the mommy makeover side. And this is really your specialty. So tell me, I mean, we always hear mommy makeovers. What does a mommy makeover truly entail?
Usually it is breast surgery. Often it is an implant placed. Sometimes it's a reduction. Sometimes it's a lift. Reduction also lifts the breast as well. Uh, when we are pregnant, our breasts get bigger. When we breastfeed, they get even bigger. And then they shrink in size somewhat. So then they tend to be a little bit more droopy or ptotic, and that's where a lift is helpful. Sometimes we lose enough weight that our breasts get smaller and we don't like them, or We liked being a little bit bigger when we were pregnant because of the breasts, the way they look then. And so that's when some of my patients decide to go ahead and put an implant in. And so I do that. The other part of the mommy makeover is the abdomen. Obviously, after 9 months and who knows what size baby that or twins have been in there, the skin and the muscles are stretched. The muscles actually can pull apart, and so part of it is that we bring the muscles together, and then we also take off the excess skin that there is. And so that's called the tummy tuck or abdominoplasty. Um, and what we do is get rid of the excess skin, pull the muscles closer together, which also gives you better waistline definition and better core strength. If the muscles are really pulled far apart, it can lead to lower back pain and to constipation. And so by bringing the muscles more where they belong, the core strength is improved. And it, don't fool yourself. It's not a lack of doing sit-ups and crunches. All the sit-ups and crunches in the world don't bring those muscles back together. It's only done surgically. And then we can get rid of the excess skin. That gives you a nicer contour as well as the strength.
Okay, so obviously it's not surgery for the faint of heart. This isn't something you're walking into and you're ready to go in a couple of days. So how does somebody prepare for a mom who says like, okay, I'm ready. Like I'm gonna take back a little bit of my body. I'm ready to do this. And how do they prepare? And then what does recovery look like from something like this?
So I tell them that if they have small children, they're going to need some help because for the first 2 weeks, I ask them to limit their lifting to about 10 pounds and not to drive because between the anesthetic, the pain medication, although I use non narcotic, it still makes you a little bit woozy or drowsy. And then the inability to do a hard brake if we've done the abdominoplasty or a hard right or left turn so that you're a good defensive driver against all the people who really shouldn't be driving out there. Um, you, you really can't be the safest driver in terms of your own defense. And so we ask that you avoid that for about 2 weeks. You can shower, but with the abdominoplasty, the tummy tuck, we have drains, so you can't immerse in a bathtub. And that means you're not going to go to the pool or the beach with the little ones because that can cause infection around the drain sites. You have to have a good support garment, so a bra or a modified um, sort of panty girdle, but it's surgically modified, so it's got hooks and it's got eyes or zippers so that it's easy to get in and out of, but it has firm elastic so it supports you, which means it's also kind of warm, but it actually feels better to support you. Most people don't get their normal energy back for about 6 weeks, but by that time they're back. They've already been back exercising and getting more active, and most people are back to their full exercise routine. Maybe not quite as hard or quite as fast by 3 months. So it's not a minor thing.
It's not a minor thing, but in the scheme of things, I mean, that doesn't sound terrible. I saw somebody who had one on Instagram and they had this whole full body situation. Is that something UTMB Health provides, or is that something like you like go and get off your Amazon?
So you can get it at Amazon. I suggest that you get it from a store where you can go and
I'm
get
sorry.
measured. And there are a bunch of places around where we can recommend people who we know are good vendors who will take good care of our patients. Because it has to be pretty well sized to the patient, we don't have the ability to provide that. So I can't do that. Um, so we can recommend.
All great information. So are there any other considerations if a mom comes to you and this is what I'm thinking, I'm ready to do this, and what other things would you tell them to be prepared for?
make sure you're doing it for yourself and that this is something you really want, because there will be some discomfort, although really the pain we can manage very well. I do multimodal, so there's less nausea, less drowsiness with it. Um, there's some um, inability to like raise your arms for the first few days after breast surgery, and for the first 7 to 10 days, because we pull your abdomen really tightly, you'll be bent over a little bit when you're walking. Getting in and out of bed, we give you tricks so that it's more comfortably done, but basically you want to support yourself. For those who have had a C-section, they know what that means.
That means walking around with a giant pillow. I remember doing that with my twins, and I just walked around with a pillow to like do anything.
Right.
Yeah, so been there. I think that's really good advice that you're doing it for yourself. That's not being instituted. I do have a follow-up question on that. Have y'all seen an uptick since COVID of people coming in for mommy makeovers? Because I feel like people who have just privately reached out to me, I know a handful who have done this since COVID hit.
Yes, especially since people can work from home. That way they don't have to take as much PTO. Um, and so they're working within a few days, even maybe part time, but they're definitely working from home. So it's easier. So, and you have more privacy. You know, there's nobody there to see that you're having to take breaks more frequently or even taking a nap during the day. So it's your secret to share or not, depending on how you want to do it. That's one thing. The other thing is that as people have been at home more, not so much with mommy makeovers, but with facial, and I'm sure Dr. Kroger's seeing this too, they're seeing themselves on Zoom, not necessarily liking what they saw, and so they're coming in for consultation for facelifts, neck lifts, things like this as well.
I can totally see that. I mean, I tape videos, I mean, kind of for a living. This is what I do. And uh I for sure have had like my moments of like, oh, okay, like we're just not going to do a video first thing in the morning until we've taken care of this. And so I get that. And I think the COVID flexibility, what a great time to be able to, go on. You can catch your meeting and go take a nap, recover. They don't see the pillow sitting here. And so I think that's all really, really good advice. We're going to shift over to Dr. Kroger and chat about all things Botox and fillers and all of those non-surgical options. And so let's talk about some of those. What are some options for people who feel like they need just a little bit of oomph, but aren't quite ready to go under the knife yet?
Yeah, so I always start off with saying by no means are the non-surgical procedures a replacement for surgery. In certain parts of the body, I think a lot of those treatment options are a little bit more limited, or if there's a lot of skin laxity, which means there's a lot of loose skin, sometimes surgery such as a neck lift or a facelift is a better option. And so I really think it's great at our center. We actually have patients come in for consultations because it can be so overwhelming. Honestly, even as a dermatologist, I'm overwhelmed by how many new lasers come out each year, how many body contouring devices are out there. It can be very overwhelming, even for physicians. So I imagine it is, for a lot of patients out there as well. So really, I recommend people to come in for a consultation, and that way we can really talk about what bothers you and what concerns you. And then honestly, also talk about budget, because, fortunately, we don't have, an endless budget for a lot of people. And so we can really kind of plan what priorities we want to focus on, and it really lets us set out a plan. And so I'm further kind of able to go into what I can offer. And if I think surgery is a great option, that's why it's really great in our center that I can, go ahead and refer to Dr. Phillips if I think a neck lift or a facelift would do better for someone rather than, fillers. So In terms of things we offer in clinic, we have a wide variety of things. And I think that's really important because aging just doesn't happen only on the surface level of the skin. Aging really happens in all layers. So for example, for a lot of women, we get bone resorption. So we get a lot of thinning, especially on our jawline. You'll kind of notice that it recedes a little bit over time. Our fat pads in our cheeks, they shrink, and then gravity takes hold and everything just shifts downwards. And then also the surface level, in terms of the highest level of skin, you get a lot of dehydration, you lose collagen and elasticity. And so you end up just looking a lot more worn down probably than you'd like. And so at our clinic, we're able to offer a lot of different things. And so kind of the first group are injectables. And so we do offer neuromodulators. And here in our clinic, we offer Botox. So Botox is one that we use mainly to paralyze muscle. That causes wrinkles from that. So a lot of women get Botox between their eyebrows here. That's what women call the 11 lines.
Mm-hmm.
And then the forehead lines are a really great place as well. And also a lot of the lines that we get kind of on the side, which we call our smile lines, or some women like to call them their crow's feet. And so Botox is a great area for that. And then filler kind of does something different. So I take a lot of time in explaining that in a lot of consultations. A lot of people kind of get those two things mixed up. So Botox is more wrinkles that you get from movement. And then filler is really helpful for basically revolumizing the skin. So we all lose about a teaspoon of collagen each year after the age of 30, unfortunately. And so really fillers are able to help one lift, but also revolumize. So it does something totally different than Botox. And so a lot of my women are honestly getting both when they come to see me. And then you have things like looking at the surface changes. So is your skin texture not how you like it? Is there a discoloration that you're not happy with? And that's when we start talking about things like resurfacing lasers, chemical peels, and then also just lasers to really target pigment. And so we offer all of those in our clinic. So it can be really overwhelming, even with all, like I said, the options that are out there. But I think if you start with a consultation with us, we can definitely kind of get you in the right direction and really set up a plan that you'll feel comfortable with. So.
And that's such an important point to mention, and especially from your comprehensive care. That's something we always mention on these videos, is that y'all are so good at referring out. If you don't think that maybe your patient is a good fit here, but might work better over here, y'all are awesome about transferring care there and truly setting a plan. And I think budget, I mean, these are things that aren't typically covered by insurance. For the most part, I know long time ago, I had a breast reduction and it was covered by insurance because of back pain. But I think that, that it was, your breast implants aren't typically covered by insurance, and surely not your Botox and your fillers. And so budget is such a consideration. I think sometimes when we think of mommy makeovers and we think of people getting things done, and you may see people on media and you're like, whoa, sister, you went a little too far. How do you counsel your patients on maybe we should just stick here, this is okay right now? Like, how do you not let them go too far to the other side?
So I'm pretty honest. I mean, most patients, if they look like that, they've been overdone. And so I think you'll get, at least at UTMB, you'll see a lot of us, especially in dermatology, and I'm sure in plastic surgery as well. I mean, I have refused to treat certain patients if I thought they didn't need it. There are certain things kind of in the range of what's aesthetically beautiful, but if I really do think that I'm doing more harm to the patient, that it's not what's in their best interest, I mean, I definitely have told them no. And then a lot of my first time patients who do have that fear because they see celebrities who just have such full cheeks or lips that are way too big, for their lower half of their face. I mean, I tell them that my goal for them is to still look like themselves. I really don't want people to really know that they had work done. I like what Dr. Phillips said. It's like your secret to share. It's really up to you if you want to tell people, but my goal is really for no one to really know that you had filler done or that you had Botox done. I really just want patients to look refreshed, like they got that extra hour or two of sleep that probably a lot of us moms really do need. So really that's always the goal. And the nice thing is we always see patients at follow-up. And I think that's why setting expectations is really important, and really having that first initial consultation really to kind of go over that. So that's kind of my perspective on things. Is I definitely will say no, but also kind of just ensuring patients that I'm not going to make them not look like themselves. So
Having that confidence that you're not going to walk out looking like, well, we won't say who, but we will walk out looking like a different version of yourself. I like the extra hour of sleep thought. Dr. Phillips, is that your experience as well?
Yes. On occasion, you'll get a patient who has what I'd call unrealistic expectations. And I have rarely refused, though, but I've had to do that sometime. And sometimes it's just, okay, I need to explain to you exactly what this might do. Like if you use Botox around the lips, you might not be able to purse your lips or whistle, or even speak as easily. And so trying to talk somebody back from something.
I think it's so important. So we know that y'all are here for our moms, and just to make them feel like the better, like the best version of themselves, if that's what is in their wheelhouse. I know we touched on a lot, and I feel like we could be here for a while. Is there anything, Dr. Kroger, you would like to add that we didn't cover?
I think just really do your research and really find, board certified physicians and providers that definitely have the experience and knowledge who can take you on the journey from the beginning, to the end. And at UTMB, we have that. So come see us. We'd be really excited to see you.
I think that's important too. I mean, we see these, fly by night parties and things like that. I don't know. I want to have someone there for the follow up. Because I may have heard from a friend at one time it didn't go exactly the way it should have, and it needed the touch up. You know what I mean? And so, Dr. Phillips, again, I know we touched on a lot in your area, but there's so much more. Is there anything that you would like to share with our audience?
Please just listen to your physician, and as much as you can, follow the post-op or post-injection, post-treatment orders, because it's done for your best outcome and safety as well. And that's our prime goal, that, and then also your appearance. But safety is always first, whether it's with Dr. Kroger and Dr. Kelly in dermatology or with me in plastic surgery. We want you to be happy and healthy, and we're here for you.
I love it. So, again, the plastics and aesthetic surgery or center came back April 2021. It came to be, and so they have everything that y'all need at home. And if you are ready to explore any of these options, whether it be dermatology or something more surgical, and we will take the advice of Dr. Kroger, that go ahead and have that consultation, and they will walk you through the steps, let you know what's needed, what all is required. We will make sure to drop those and links in the comments below so you can make sure to access one of these great departments, or both, or and we just want you to have all the information, Houston moms, and we are grateful, Dr. Phillips and Dr. Kroger, for joining us today.
Thank you for having us.
Thank you for inviting us. It's been fun.
Yeah.
Always a joy. And I love talking about this because I don't think we talk about it enough, to be honest. And there's a lot of us out there who are either thinking about it, have done it, know somebody who's doing it, or just simply needs advice for how to, go for the next step. So go check out UTMB Health. We're thankful for their partnership with us. And until next time, we will see you next month. Take care.